Healthcare for all. Kenya has been chasing this dream for decades. Then came the Social Health Authority, or SHA, the government's bold new push for universal healthcare coverage. But what exactly is SHA? Why was it created and why is it trending for all the wrong reasons? Let's break it down. So SHA is the Kenya's new health insurance system. It was launched in 2023 and it replaced the National Health Insurance Fund, or NHIF, with one goal: to provide affordable, accessible healthcare for all. It operates through the Social Healthcare Fund, which is SHIF, and the Primary Healthcare Fund. Think of it as a safety net designed to protect over 25 million registered citizens from high medical costs. So, how did it all start? In 2022, President William Ruto's administration made universal healthcare coverage a top priority. The result was the Social Health Insurance Act of 2023. Ahead of its launch on October 1st, 2024, the government allocated 6.1 billion for SHA. This amount was intended to support the initial rollout phase. So in summary, the initial SHA budget allocation was 6.1 billion. The supplementary release was 9 billion. This bringing to 15.1 billion as the total SHA-related allocation. This new law scrapped NHIF and created SHA, a new system that was built to fix the old problems that Kenyans had, which include inefficiency, corruption, and poor services. With promises of digital tools and accountability, it was supposed to be a fresh start. Sounds great, right? Well, quite not. Barely 2 years after the launch, SHA was rocked by scandals. Billions of shillings meant for healthcare were alleged siphoned off fraud claims, including payment of ghost hospitals. What exactly is a ghost hospital? These are facilities that doesn't exist, or tiny clinics ranking in millions. For example, to teach a medical center, a one-room facility received 1.5 million in just 1 month, while larger legitimate hospitals went unpaid. It's getting worse. The Auditor General's report found that the government injected 104.8 billion into SHA, yet neither owns nor controls the system. That raised major red flags. Even Busia Senator Okiya Omtatah even called it a grand theft, demanding SHA to be suspended. Over 10.6 billion in claims have been rejected due to fraud, fake hospital records, inflated bills, and even claims of multiple surgeries on one person. The fallout? Hundreds of legitimate hospitals are still waiting for payments, some dating back to November 2023. The Rural and Urban Private Hospital Association has warned these could cripple the health care. What are Kenyans saying online? The public outrage is growing. Kenyans are voicing their anger on platforms like X, Twitter, Facebook, and Instagram, comparing the corrupt NHIF days or worse. So what's being done? The Health Cabinet Secretary Aden Duale says the government is cracking down. So far, 35 private hospitals have been shut down and 40 others suspended for fraud. New measures including biometric verification and AI-powered systems to track claims and stop abuse. Over 7.7 billion has now been paid to legitimate facilities. Some rogue doctors are facing disciplinary actions, including suspension of their licenses. Despite all this chaos, SHA has enrolled over 24 million Kenyans. Around 4.5 million have already received treatment, and the digital tools are starting to expose the fraud. But these billions are unaccounted for, and the public trust at all-time low. SHA has a long road ahead before it can deliver on its promise of health care for all. The SHA was meant to revolutionize Kenya's healthcare system. Instead, it's under fire for corruption, mismanagement, and broken promises. Can SHA recover? Can it build the trust and true deliver healthcare coverage? That depends on transparency and action. What do you think? Drop your thoughts.